You know that tiny pill that might be in your medicine cabinet? Ever wonder what it actually does? Well, today, we're diving into one of the most prescribed medications on the entire planet, amlodipine.
So let me ask you a question. What's one thing that literally millions of people all across the globe have in common? Something they do every single day.
You might be surprised to learn that for many of them, it's taking a tiny little pill to help manage their heart health. So let's get right into it. What exactly does this pill do and how does it work?
Here's a quick look at what we're going to cover. We'll start with the pressure problem amlodipine is designed to solve. Then, we'll meet the gatekeeper to understand how it works its magic. After that, we'll get into the practical stuff, doses and names, potential side effects, and finally, some key tips for taking it safely.
Okay, first up, the pressure problem. So, what's going on in the body that would lead a doctor to prescribe amlodipine in the first place?
Well, its number one job is tackling high blood pressure, also known as hypertension, but it's also prescribed to prevent a certain kind of chest pain called angina, and it helps manage coronary artery disease, which is just a fancy way of saying the blood vessels that supply the heart have gotten too narrow.
So, how on earth can one tiny pill do all of that? To really get it, we need to meet the gatekeeper.
It all comes down to this term. Amlodipine is a calcium channel blocker. And you know what? The name tells you pretty much everything you need to know. It blocks channels that let calcium into certain cells. But why is blocking calcium such a big deal?
Let's use that gatekeeper analogy. Think of calcium as a signal that tells your blood vessels to tense up and get tight. When they tense up, it's like pinching a garden hose. The pressure inside shoots way up. That's high blood pressure. So amlodipine comes in and acts like a gatekeeper. It stands at the entrance to these cells and limits how much calcium can get inside. With less calcium, the blood vessels can just relax. They widen, blood flows much more easily, and boom, your blood pressure comes down. Pretty smart, huh?
Okay, that's enough of the science. Let's switch gears and talk about the practical stuff you need to know for day-to-day life.
You'll most often see this medication under the brand name Norvasc. The generic name is simply amlodipine. For most adults, a typical daily dose is going to fall somewhere between 5 and 10 milligrams. For kids, it's usually a bit lower, typically in the 2.5 to 5 milligram range.
All right, let's move on to a really important topic for any medication, the potential side effects. It's so important to know what to keep an eye on.
Now, it's key to know the difference between what's fairly common and what's a red flag. On the more common side, some people might notice swelling in their ankles or feet, feel a bit dizzy or sleepy, get a warm, flushing feeling in their face, or even have some nausea or palpitations. But, and this is a big but, if you experience things like severe chest pain, feel like you're going to faint, or see any signs of an allergic reaction like your face or tongue swelling, you need to call your doctor right away. Don't wait on those.
And this brings us to a critical safety warning. And it's so important we're highlighting it here with a quote. You should never, ever, just stop taking amlodipine cold turkey. Stopping suddenly can cause your condition to get worse. So if you need to make a change, you have to talk to your doctor first so you can do it safely.
All right, we're on the home stretch. Let's wrap up with some simple, everyday tips for taking your dose as safely as possible.
Probably one of the most common questions people ask is about food. Does it really matter if you take it with a meal or not?
Well, let's see what the science says. Studies have shown that taking amlodipine even with a high-fat meal has almost no real effect on how much of the drug gets absorbed into your body. So the short answer is, no, it doesn't really matter. With or without food, you're good.
But hold on a second. While meals in general are fine, that is definitely not the whole story when it comes to food and amlodipine. There's one huge exception. And here it is, the grapefruit warning. This is a big one. You have to avoid both grapefruit and grapefruit juice completely. Why? Well, compounds inside grapefruit can mess with your body's ability to process the medication properly. This can cause the levels of amlodipine in your blood to skyrocket, leading to an unpredictable and frankly dangerous drop in blood pressure. So, no grapefruit. Period.
Okay, so to put it all together, here's your simple daily checklist. 1. Try to take your dose at the same time each day for consistency. 2. You can take it with or without food, your call. 3. Absolutely avoid grapefruit. 4. Never ever stop taking it suddenly. And 5. Make sure your doctor knows about every single other medication or supplement you take.
All right, if you only remember 3 things from this, make it these. First, amlodipine works by relaxing your blood vessels, which lowers blood pressure and helps prevent chest pain.
Second, common side effects like ankle swelling can happen, but you must report serious symptoms like severe chest pain to your doctor immediately. And third, take it consistently every single day. And always, always avoid grapefruit.
And that is Amlodipine explained. What other common medications are you curious about? Let us know in the comments what we should break down in our next explainer. Thanks for tuning in.